DBS stands for Deep Brain Stimulation in English, which means stimulating the deep areas of the brain. With DBS, I don't want to get too deep into the scientific details now. It has been proven that if they stimulate certain deep parts of the brain, the symptoms of Parkinson's disease improve. What happens is that two electrodes are placed in two parts of the brain at a specific angle, using a very complex technique that requires a high level of expertise. The tips of these electrodes are positioned exactly in those areas, in what we call the basal nuclei of the brain, which play a role in the Parkinson's circuit. These electrodes stimulate those areas, and this stimulation leads to the creation of new circuits, ultimately improving the symptoms of the Parkinson's patient. These are the two electrodes. To put it simply, a battery, actually a pulse stimulator, something that provides stimulation, is placed under the skin. A thin wire runs from the neck to these two electrodes and delivers the stimulation. The DBS surgery is performed in two ways. Around the world, one way is with the patient fully under anesthesia, or in some cases, the patient is awake during certain parts of the procedure. Performing the procedure with the patient fully under anesthesia requires very advanced technology. Even worldwide, this is only done in a few regions and centers, and usually in other places, including our country, the surgery is done in such a way that, in the first part, when we make the holes, which we call burr holes, because this part is painful, the patient is given light anesthesia. For the rest of the procedure, during the surgery, the patient is awake while the electrodes are inserted into the brain. At that point, stimulation is applied and the patient is asked, "How are you feeling?" They ask if your tremor has improved and so on. So, the procedure performed in Iran involves some anesthesia, but for most of the surgery, the patient is awake. It's a procedure where the electrode has to be inserted at very specific angles to avoid hitting any blood vessels or vital structures in the brain. It takes some time, meaning the duration of the surgery is a bit long. Sometimes, in the surgeries we've attended, it can even take 3 or 4 hours. But for most parts of the surgery, the patient is awake and can see what's happening. That is, the patient can feel it, and in fact, we want to observe which symptoms improve or worsen for the patient during the stimulation. So, to put it very briefly, that's the DBS procedure. But there's a very important point that viewers should pay attention to. The DBS surgery itself is only for Parkinson's disease, and here we need to get into a discussion. There is a difference between being Parkinsonian and having Parkinson's disease.